Simon here, talking to you about the shoulder and ways to prevent injury when you train at the gym. So what's happened is recently I've seen a few patients and they all came in with shoulder pain, and we looked at potential triggers, and we discovered that if we modified slightly their ways of training at the gym, their form, we could get them to have fewer injuries. And the pattern that seemed to come, the problematic pattern that seemed to come back with all of them was they had this idea in mind that good form when training for the shoulder was to pull the shoulders back and down, and then from there they could do their rows, they could do their training the pecs, they could do all sorts of pull downs and that kind of stuff, and so they had this sense that to have good form, shoulders back and down, and then staying there with good form, and then you can and off you go. With the shoulder, I'm not so convinced. Quick disclaimer here: I'm not a personal trainer. I occasionally go to the gym. So if you have a personal trainer that gives you advice, obviously listen to that. And also, if you have someone who observes you when you do the exercises, then then of course if they give you indications, obviously follow that. And you'll see that having someone observe you is probably helpful in avoiding the mistakes that I'm going to talk about. But in case you're training on your own and you have shoulder pain, or you want to avoid having shoulder pains when you train, when you do arm movements or when you train your shoulders at the gym, then this video might be of interest, because for each patient the advice was exactly the same. And I'll tell you what it is. So, and it's basically to not do that, to allow the shoulder to move harmoniously with all its bits working together. And it's often about, in osteopathy, many forms of manual care, we think about distribution of workload, making sure that all the joints are doing their job and all the muscles are recruited the way nature designed them to be recruited. And with the shoulder, what's interesting is that it's a really complex joint. In fact, it's called the shoulder complex. And so we think of the shoulder sometimes as maybe the glenohumeral joint, which is this joint here between the glenoid fossa and the humerus, hence the name. And so of course we've got movement there. But interestingly, a lot of shoulder movement is going to come from the shoulder blade. And so if we think about the bony attachment between the arm and the axial skeleton, the rest of us, there's only the clavicle, really. The shoulder blade, otherwise at the back, it's attached here by a wire, but otherwise it's not really attached to anything. It moves quite freely around the ribcage. And so, for example, when we think about raising, let's have a look at you in a minute, but there we go. When we think about raising the arm out to the side, the glenohumeral joint, that joint, only goes to about 90 degrees, and then anything further is actually coming from the shoulder blade moving, and then probably the thorax and probably the ribs. And so you have several joints in the shoulder complex. You've glenohumeral joint, then you've got the acromioclavicular joint at the end of the clavicle, the sternoclavicular joint, and the scapulothoracic joint at the back. So they all need to move harmoniously. If you've got all of these joints, of course, nature gave you muscles to move all of these joints individually. So you have maybe the rotator cuff, maybe the deltoid moving on the glenohumeral joint only. But as soon as you've got muscles that go from the humerus to the axial skeleton, maybe pec major, maybe the lats, maybe the traps, suddenly these muscles are moving both the glenohumeral joint and the scapulothoracic joints. And so they have this kind of combined movement. So the traps together, are going to produce, actually no, the traps only attach on the, apologies, on the scapula and the clavicle. It doesn't actually abduct the shoulder at all. The lats and the pecs, however, do move both these joints. So if we think about the lats contracting, then we get this kind of movement. If we think about the pecs contracting, we get this kind of movement. Both the humerus and the scapula moving together. And so your body has ways of controlling exactly what movement it wants from the shoulder blade, and then from there what movement it wants exactly from the glenohumeral joint. and we're not always aware of those movements, you know, and how they work and what muscles we contract. And of course, we're not aware of what muscles we contract to produce what movement. That would be, you know, too much of a headache. And so we're not consciously aware of it. So the few presentations that I've seen recently was one person complaining of shoulder pain at the front, especially when they were doing, you know, pull downs. And so what they were doing was doing good form, not good form, shoulder down and back, and then doing the pull down. But what they had to do was to manage to pull the shoulder down without engaging the lats. So when you do a pull down, ideally what you want is those lats that attaches here at the front of the humerus and then down into, you know, into the mid-thoracic low back and then onto the sacrum and pelvis. And so if you engage that great big muscle, you get this lovely movement of, you know, pulling down, and ideally that's what you'd want to do. If what you do is first pull the shoulders down without lowering the arm, you've got to engage, you know, other muscles, maybe probably the lower traps, sort of thing. And so you engage the lower traps. Your brain goes, okay, great. So I'm going to engage the lower traps. I'm going to achieve that movement of lowering the shoulder blade down. But I'm not going to engage the lats because at the moment I don't want to do, you know, my body doesn't want to do this. I'm not taught to do this movement, so I'm not going to fire the lats. And so suddenly what she was doing this, turning the lats off, and then from that movement she would do this, she would then lower her arms, but instead of engaging the lats to do that movement, suddenly it was all about probably posterior belly of delt and deltoid and maybe anterior belly, not so much, posterior belly of delt mostly. And so suddenly there is this great big shearing force at the shoulder, and she was really stressing the anterior, the long head of the bicep there at the front of the shoulder. Anyway, we don't need to get too technical, but basically what happened with this patient was that instead of engaging that great big powerful muscle to achieve this movement, she decided to break down the motion into this, which forced the lats not to engage, and suddenly there was an awful lot of stress and strain around the shoulder joint, because these muscles suddenly had to do all the work. And so in trying to be very, very clever, there was actually a poor distribution of load across different areas. And so the modification that we brought was, no, let the whole shoulder girdle, the whole shoulder complex move harmoniously up and down, allow the arms to go up and down, allow the shoulders, and so suddenly the lats could engage, and suddenly the shoulder pain went away because there was better distribution of workload. Very similar thing to someone who was doing rows, and so what they were doing was pulling the shoulders back and down, and so suddenly they couldn't really engage those muscles that are pulling back because they'd already pulled the shoulders back, but they still had to have the arms forward, and so they were switching off a whole bunch of muscles that were crossing over that, those two joints, and suddenly there was an awful lot of load around more the rotator cuff and posterior delt again, and so they started developing pain. And then the last patient that I'm thinking about was talking about they actually have shoulder pain. And they were saying, oh, if I pull my shoulders back when I do this, training the pecs, then then I don't get the pain. Like, okay, great. Well, if that's the adaptation that you need to bring in order not to feel pain, fine. However, again, what you're doing is, if you pull the shoulders back, what you're doing is you're telling your brain, okay, well, I can't contract my pecs now, because if I did contract the pecs, I would do this movement. And so by pulling the shoulders back, you're switching off the pecs, and suddenly again the workload, instead of being in that pec that's supposed to do that movement, has to be done by different muscles, and then they are more likely to be stressed and strained. So shoulders are complicated, complex joint really, or a complex of joints. Annoyingly, we can't be consciously aware of what muscles we're contracting to do what movement. And so the best idea usually is to trust that nature came up with a clever design to distribute load in different ways, and we can probably trust that, you know, that she came up with a good design. And so when you move and when you train your arms, instead of thinking, I'm going to remove this entire range of motion out of my training and load the crap out of my shoulders, instead of that, you can think, okay, well, can I distribute workload evenly when I train? Can I have my arms and my shoulders moving together and distributing that workload a bit more evenly? So see if that's helpful. Again, if you have a personal trainer who says, you know, who says differently, if you've got a professional who says differently, they might have different thoughts and ideas in mind, and they might want to target specific muscles, at which point great. But I think if you want to try and avoid injury, and if you're training on your own, then this is probably a good thing to think about. But yes, when you do arm movement, shoulders back and down, not convinced about this one. So if you do develop shoulder pains, then that might be something to think about. And of course, if you like more details, come in and we'll assess you and we'll see what's going on with you. But it's a pretty good rule of thumb, this one. So to prevent injuries, that's a pretty good one. I hope this was helpful. Have a good day.